OPD syndrome, Oro-Palato-Digital Syndrome, is a rare genetic disorder that affects the development of the oral cavity, palate, digits, fingers and toes, and other body parts. It is inherited in an X-linked pattern and has two major forms, type 1 and type 2. Type 1 is less severe and compatible with life, whereas type 2, known as Taybi-Linder syndrome, often involves severe malformations and is usually fatal in infancy. Key features of OPD syndrome include oral and facial features such as cleft palate or high arch palate, small mouth, and facial dysmorphism with distinct facial features like a broad nose or prominent forehead. Palatal defects include cleft lip or palate, causing speech and feeding difficulties. Digital abnormalities consist of short, bent, or missing fingers and toes, syndactyly, which is the webbing of fingers and toes, and clinodactyly, the curving of digits. Skeletal abnormalities may present as short stature and underdeveloped or deformed bones, particularly hands and feet. Some individuals with OPD syndrome may have mild to moderate intellectual disabilities, though cognitive function can vary. Other malformations can include hearing loss, respiratory issues, and heart and kidney abnormalities. Now, let's move on to some multiple choice questions on OPD syndrome. 1. What is the mode of inheritance of OPD syndrome? A. Autosomal dominant. B. Autosomal recessive. C. X-linked recessive. D. X-linked dominant. Answer: D. X-linked dominant. 2. Which of the following is not typically associated with OPD syndrome? A. Cleft palate. B. Syndactyly. C. Intellectual disability. D. Hyperextensible joints. Answer: D. Hyperextensible joints. 3. What is the primary clinical feature of OPD syndrome? A. Severe neurological deficits. B. Oral, facial, and digital abnormalities. C. Muscle weakness. D. Liver dysfunction. Answer: B. Oral, facial, and digital abnormalities. 4. Which of the following is characteristic of OPD syndrome type 2, Taybi-Linder syndrome? A. Severe limb malformations and fatality in infancy. B. Only mild facial deformities. C. Normal life expectancy without complications. D. Respiratory issues without limb malformations. Answer: A. Severe limb malformations and fatality in infancy. 5. Which gene is most commonly associated with OPD syndrome? A. FBN1. B. FLNA. C. COL1A1. D. TSC1. Answer: B. FLNA. 6. Which of the following is a potential complication of OPD syndrome? A. Hearing loss. B. Liver cirrhosis. C. Hypertension. D. Diabetes. Answer: A. Hearing loss. These questions provide a foundational understanding of OPD syndrome, its clinical features, genetics, and complications.